Most hockey players with lower back pain are told their glutes are weak and not activating. So they get prescribed a bunch of glute activation drills, like clamshells and band walks. While that might help a little bit, it usually doesn't solve the problem. The real issue is many hockey players lost the ability to do what the glute does best: create hip extension. In other words, bringing the leg underneath the body, or allow the pelvis to rotate back properly. If you can't access hip extension well, your glutes can't contribute efficiently, and your lower back ends up getting the extra work. Most players with back pain usually fall into two categories: having a pelvis that's tipped forwards, the hips being stuck in hip flexion, or being more in a swayed back posture, where the pelvis is tucked underneath the body and the hips sit forwards. Both of these positions limit true hip extension, just in a slightly different way. Here's a simple postural drill that will regain that true hip extension. All you need for this exercise is a door frame. Lightly touch your hand against the wall around shoulder height. Drop it to the bottom position of a split squat. Make sure your back knee is directly underneath your back hip. Gently press your hand into the wall and allow your hips to hinge slightly. Go until you start to feel a slight stretch in your glutes. Keeping a neutral spine, your weight heavy on the front foot, maintaining 3 points of contact being your heel, your big toe, and your pinky toe. Maintaining those 3 points of contact until you stand up. Don't think about bringing yourself up. Think about pushing your foot into the ground. You'll feel a lot more glute activation. You want to do 5 to 10 repetitions of 2 sets of this drill to get proper hip extension back.